Why aren't babies put into nurseries after birth in the majority of maternity units here in the UK anymore? So I'm going to give you a little bit of a history lesson about baby nurseries and also about rooming in, which is the practice of keeping the mum and baby together 24 hours a day from the moment the baby is born. There are very few maternity units that still exist that still have nurseries available. Often these are in private units where people pay an additional premium to be able to have their baby taken away into a nursery setting. So as a bit of a history lesson, nurseries never existed before there was a huge increase in the amount of women having hospital births. Prior to births moving into hospital settings around the sort of 60s, 70s and 80s, women would have home births, and from that point onwards they would solely care for their babies, rooming in. Breastfeeding rates were far higher, but also you would have had that huge community feel because you would have had your neighbours, your sisters, your mum. You all lived in the same community where there would be that support on hand should you need it in that postnatal period. In the immediate postpartum, what would happen is that baby would feed. The mum and the baby would also be in the same bed. They would be bed sharing at that stage too, and so breastfeeding rates were far higher. And then what happened is birth moved primarily into hospital settings around the 60s and 70s. And in that postnatal period, you would be in, say, a 10, 12, 13, 14 bedded bay with lots of other mums and babies. You can imagine that there is very little sleep when you are in a bay of 14, 15, 16 other mums and babies. And so it was deemed as kinder to take the babies away so that women would get more sleep overnight, because this was a time when women would have a 5 to 10 day stay as an inpatient in a hospital. And so it was deemed kinder that the babies were removed into a nursery to enable maximum sleep for the mums. And nurseries were removed because of the huge unethical practices that happened in baby nurseries around the 70s and 80s. So when these babies were removed from their mums, there were several things that happened. So firstly, scheduled feeding was a thing where you could only breastfeed your baby for 5 to 10 minutes on each boob. What would also happen at that stage as well is when your baby was in a nursery, often healthcare professionals would give formula substitutes to try and keep these babies asleep for longer as well. And that was completely unethical because the parents were never aware of it. And that was because of the unethical marketing strategies from companies like Nestle, for example, in promoting to healthcare professionals and saying, give these formula substitutes out. Nestle totem baby nurses were also very prevalent on postnatal wards at that stage as well. And that's where they would dress up as nurses and walk around the wards and hand out free formula to parents. Now, anyone who's seen any videos of mine before will know that breast milk works on supply and demand. The more the baby goes to the breast, the more you produce overall. And so having those formula substitutes in those early postnatal periods, what would actually happen is it would impact on breast milk supply. That would mean parents would be more reliant on formula overall and need to buy more formula as a result. And those parents in a postnatal ward would either walk to the nursery and feed their babies or have their babies brought to them to feed for literally 5 to 10 minutes, so not really enough to be able to help establish supply, and babies would then be taken away. What this did is it had a massive impact on breastfeeding rates, so breastfeeding rates declined globally, but it also had an impact on bonding and attachment as well. Now the challenge is rooming in has never been systematically evidenced, it has never been systematically looked at from a research perspective, and so it's all anecdotal about keeping mum and baby together. But nurseries have been removed from any hospital that is working towards their BFI accreditation, so Baby Friendly Initiative accreditation. The Baby Friendly Initiative accreditation is all about trying to protect and trying to help promote bonding and attachment in babies, growing healthy, happy babies, and also increasing breastfeeding rates through improved support for parents. And one of the 10 steps towards successful breastfeeding is to help with rooming in. And so rooming in is one of the top 10 steps to help promote successful breastfeeding journeys. And there are some circumstances where rooming in is not recommended, and that's on an individual perinatal mental health plan, whereby it's recommended that sleep in that early postnatal period, particularly for women who have got previous psychosis, for example, where rooming in is not always recommended, and where sometimes support workers or other family members take the baby out of that room in that early postnatal period, because we know how vital sleep is for anybody in the postnatal period, but particularly for mums who have got a long history of perinatal mental illness. There's also another benefit to rooming in, and back in the 70s, 80s, there was lots of concerns about babies being swapped at birth, maybe taking a different baby home. Sometimes parents, because their babies had been removed for 5 to 10 days going to a nursery, question when they get home and they've got an unsettled baby, whether this is actually their baby and whether it's someone else's. That in itself has an impact on bonding and attachment. Rooming in has been shown to help improve the bonding and attachment in that postnatal period. And I guess the biggest question is these nurseries came in because beds, huge bedded bays, were bought in. You know, if you were in a room with 10 to 14 other mums and babies, you absolutely wouldn't have got your sleep. Whereas now they are much smaller in most hospitals. There aren't many hospitals with more than 4 beds in a bay. And there are lots more hospitals that do have private rooms or private room facilities for parents to be able to access. We also have a much shorter postnatal length of stay. The average length of stay for a woman to stay in postnatally is between 1 and 2 days on average. Lots more women are choosing to go home after 6 to 8 hours. And naturally, at home, you would be rooming in with your baby. You would be in the same house 24/7. Your baby wouldn't be in another nursery with other babies, for example. You might get support, though, from your partners or from your family and friends so that you can go and get a couple of hours sleep whilst they go downstairs and look after baby for a few hours.